If you or someone you love takes a pill every single day without giving it a second thought, this video might be the most important 8 minutes you watch all year. Because new research is uncovering something terrifying. Some of the most commonly prescribed medications on the planet, the ones sitting in your medicine cabinet right now, may be quietly increasing your risk of dementia. Not in some distant abstract way, but through mechanisms scientists are only now beginning to fully understand. Stick with me until the end, because medication number 7 is one that almost everyone over 40 has taken at least once, and you need to hear what the studies actually found. Welcome back to Health Pathway Hub, the channel dedicated to giving you real, evidence-based health information that actually matters. If this is your first time here, hit subscribe, because we cover topics like this every single week, the stuff your doctor might not have time to explain in a 15-minute appointment. Let's start with number 1, first-generation antihistamines. These are the allergy and sleep medications containing diphenhydramine, the active ingredient in many over-the-counter sleep aids and allergy pills. Multiple long-term studies, including a well-known one published in JAMA Internal Medicine, tracked older adults for years and found that higher cumulative use of these anticholinergic drugs was associated with a significantly increased risk of dementia. Why? These medications block a neurotransmitter called acetylcholine, which is critical for memory and learning. Block it long enough, day after day, year after year, and the brain may pay the price. Number 2, benzodiazepines. These are anxiety and sleep medications, drugs used for panic disorders and insomnia. They work by calming the central nervous system, but long-term use has been linked in observational studies to a higher risk of cognitive decline. Some researchers believe it's the drug itself, others argue it might be the underlying anxiety or sleep disorder driving the connection. But here's the unsettling part. Several studies found that the longer someone used these medications, the stronger the association became, suggesting a possible dose-response relationship that's hard to ignore. Number 3, proton pump inhibitors, commonly known as PPIs. If you've ever taken something for chronic heartburn or acid reflux, there's a good chance you've used one of these. A large German study following nearly 250,000 older adults found that regular PPI users had a notably higher risk of developing dementia compared to non-users. The proposed mechanism involves these drugs' ability to cross the blood-brain barrier and potentially interfere with the breakdown of amyloid beta, the same protein linked to Alzheimer's disease. It's important to note not every study agrees, and this remains an active area of research, but the pattern keeps showing up often enough that neurologists are paying attention. Number 4, bladder control medications, specifically anticholinergics like oxybutynin, used for overactive bladder. Just like the antihistamines we mentioned earlier, these drugs block acetylcholine. A major study published in JAMA Internal Medicine found that people using these bladder medications for 3 years or more had a substantially elevated risk of dementia compared to those who never use them. This is especially concerning because these medications are often prescribed to older adults, the exact population already most vulnerable to cognitive decline. Number 5, opioid painkillers. Medications like oxycodone and morphine, prescribed for chronic pain, don't just carry the well-known risk of addiction. Research suggests long-term use may also affect brain structure and function over time. Chronic opioid use has been associated with changes in brain regions responsible for memory and executive function, and some studies have found associations between long-term opioid therapy and accelerated cognitive decline in older patients. Number 6, antipsychotic medications. These are typically prescribed for conditions like schizophrenia, bipolar disorder, or sometimes off-label for behavioral symptoms in elderly patients with existing dementia. Multiple studies have found that antipsychotic use in older adults is associated with faster cognitive decline and, in some cases, increased mortality. This is such a significant concern that health regulators in several countries have issued specific warnings about prescribing these drugs to elderly patients unless absolutely necessary. Number 7, and this is the one I promised you, statins. Yes, the cholesterol-lowering medications taken by literally hundreds of millions of people worldwide. Here's where the story gets complicated, and I want to be completely honest with you because this channel is about truth, not fear-mongering. Early reports and some observational data raised concern that statins might impair memory. The FDA even added a warning label decades ago about potential cognitive side effects. But, and this is a big but, many large, more rigorous studies since then have actually found the opposite, that statins might be neutral or even protective against dementia by reducing cardiovascular risk factors that themselves damage the brain, like high cholesterol and stroke risk. The honest answer is the science is mixed, and if you're on a statin for a legitimate cardiovascular reason, this is absolutely a conversation to have with your doctor rather than something to panic about or stop on your own. Number 8. Sedative to hypnotic sleep medications, sometimes called Z drugs, including zolpidem, commonly known by a popular brand name. These work similarly to benzodiazepines and have shown comparable associations in research with increased dementia risk when used chronically, particularly in older adults. Sleep is essential for brain health. During deep sleep, your brain actually clears out waste proteins, including amyloid beta. Ironically, some researchers theorize that sleep medications may interfere with this natural cleaning process, even while helping you fall asleep faster. And finally, number 9, tricyclic antidepressants, older medications like amitriptyline, still prescribed today for depression, nerve pain, and migraines. These are also strongly anticholinergic, and studies measuring what researchers call anticholinergic burden, essentially the cumulative effect of all these drugs combined over the years, consistently show higher burden scores correlating with higher dementia risk. This is particularly important because many people don't take just one of these medications. They take an antihistamine for allergies, a bladder medication, and an antidepressant simultaneously, and the effects appear to stack. Now, before you go home and flush every pill in your medicine cabinet down the drain, I need to say this clearly. Do not stop any prescribed medication without talking to your doctor first. Some of these drugs are managing serious conditions, and stopping them abruptly can be far more dangerous than any theoretical long-term risk. What this research actually gives us is power, the power to have an informed conversation with your healthcare provider. Ask if there's an alternative. Ask if the dose can be lowered. Ask if you actually still need this medication, or if it was prescribed years ago and simply never reevaluated. Many of these drugs have safer alternatives available today that didn't exist when they were first prescribed to you or your parents. The bigger picture here is this. Dementia risk isn't determined by one single factor. It's the combination of genetics, lifestyle, diet, exercise, sleep quality, social connection, and yes, medication choices, all interacting over decades. No single pill is guaranteed to cause dementia, and no single lifestyle change guarantees you'll avoid it. But knowledge is the first step toward making choices that stack the odds in your favor. If this video opened your eyes to something you didn't know before, do me a favor, hit that like button. It genuinely helps this channel reach more people who need this information. Drop a comment below and tell me which one of these 9 surprised you the most, because I read every single comment. And if you want more videos like this one, real research explained honestly without the fear-mongering or the fake miracle cures, subscribe to Health Pathway Hub and turn on notifications so you never miss an upload. Take care of your brain today, because it's the only one you'll ever get. I'll see you in the next